From what you've said so far, it seems that all the angles are covered. Does anything ever go wrong?
Unfortunately, yes. We're working with people and people can do something wrong. So all the procedures are there, but sometimes somebody forgets something, or like I said, this over package, that's really a closed bag where we put the drugs in, but sometimes they don't seal it right. And if then your bag should fall or your package falls and your infusion bag breaks, then you can have a spillage. If the seal isn't done right, you can have a spillage. So yes, things can go wrong. Unfortunately, it happens, but not too much.
I wonder, could you describe an incident from your own experience?
Yes, I can. As I told you before, we have procedure for every thing that's involved with hazardous drug preparations. But like last year, we had one incident and we had to add 190 milliliters of cisplatin in a bag of 1 liter, and our assistant didn't take the 200 ml that was too much in the bag out of the bag before adding the cisplatin, so it became a very big bag. But because the patients need a lot of fluid with cisplatin, the doctor didn't mind, and he said, you can deliver it like that. We'll give it in 1200 milliliters. So our pharmacist who did the release, he had to pack it and seal the over package. But because it's also, it has to be protected from light, we put a yellow or an orange bag over the infusion bag to protect it from light, and then it goes into the over package. But in this case, the light protecting bag was sealed together with the other bag, and this was a too thick layer of plastic, so the seal wasn't right. And then because it was quite an urgent product, the nurse came herself to get it in the pharmacy. It wasn't transported with the transport boxes that we normally do, so she took it in her hand together with some other medications, and when she left the pharmacy, this bag fell out of the outer package because the seal wasn't good, and it fell on the ground just outside the front door of our pharmacy, and the bag was broken, and it was a very big, large spill of over 1 liter. In that moment, they warned us, so myself and one of my colleagues went out of the pharmacy to clean it up with our spill box that we have for these cases. But like it was a very big spill, it was not enough material inside the box, so we asks for another colleague to bring us some extra materials. But because it happened outside the pharmacy, it was in a corridor where it's a lot of traffic, and it was also lunchtime, so a lot of people were passing by. It was very difficult to get everybody out of the contaminated area. We contacted also the cleaning facility of the hospital, but it took about 2 hours before they came and cleaned everything. So in all this time, we had to just try ourselves by avoiding people to walk through that. It was very difficult because it's also the main entrance of the pharmacy, so a lot of people have to come there, and it's also a way where lot of other people pass to go to their wards or the cafeteria or other things. So we learned a lot out of this case, and we took some arrangements to avoid that it happens again, and we also have some revised some procedures to do it better when it should happen again. So we have, like, for instance, a back entrance of the pharmacy. We can make a detour and let people go in there, so it's easier to block the way where happened a big spill. So we learned a lot of things out of that, but unfortunately it still happens despite all the procedures we have.
And do you have any closing messages for pharmacists and other frontline healthcare workers?
I would recommend people to take the guidance document, the European guidance document. which is unfortunately only available now in English, but it will be translated to all member states, countries. So it will be in all languages. And well, the Commission promised to have it done soon, but it takes always more time than we hope for. But it will come in many languages. I would people recommend read that document and go to the table which is relevant for your profession. So you need not to read the whole document, but just take the sections that are relevant, which are mostly 3, 4, 5 sections out of the whole document. Take them, put them aside of your work process you have now today, and just compare and see if you can make some improvements. And if you think there are parts in it that are better, try to implement them and follow up. And in that way, you come to a level of good practice. That's why I say it's not best practice, but it's good practice. It's good standard practice. That should be done together with the risk assessment and the exposure assessment, because it's a combination. Because what you do, you change your process and you have to validate, has it improved or not? Otherwise, it doesn't make sense. So that means that you have to do some kind of monitoring exposure assessment. Based on the results, you can decide whether or not to do it frequently, how often, it can be 6 months, once a year, once in 2 years. But anyhow, that process, and do that together with your risk assessment. If you put it in that way, I think you have a very good and easy start of improving of the working conditions related to hazardous drug exposure. So that's what I would recommend.
First of all, you have to be aware that you work with hazardous drugs. Then a good training and education of your personnel is also very important, so that people know what they're doing. And then make sure you have the right materials and the right procedures to work with, and train your people like every year, or that's a lot, maybe every 3 years, do just a retraining to make sure they get everything, and also to explain if you have some new materials or new procedures that you want to use. And in case of a spill, stay calm.
Birgit Tans and Paul Sessink, thank you very much for talking to us about this important topic. That has been terrifically interesting and very thought-provoking. For more information about the work described in this interview, please visit the website using the links in the description. And please subscribe for more news, videos, journals, and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.